Many people want to do plastic and cosmetic surgery. Some of these people are not even trained medical professionals, non-doctors doing buttock injections. We had a patient die here in Dallas a year ago on this. It's really a tragedy, but what's the deal here, guys? I mean, people are falling for these people that have basically no training. Why is that? Is it price? Is it access? Jason?
Bill, I don't understand. I think it's a really good idea if you go to your salon, okay, and you go in a back room and you get something from Home Depot through this unsterile needle and you inject it into your butt. Do you think that's a good idea?
I don't, but I do think that there are...
So why would they do it for? What's wrong with these people?
I think that patients don't know what's going on. I do think that
Oh,
they're
their friend
driven
did
by
it. Their friend
price,
did it.
and I do think that they are driven by living social Groupon, things that are sort of easy, quick, and non-confrontational. I just think it's easy. I think that's why people do it.
So my friend did it, and she had some stuff injected into her butt, and then the other 3 friends ended up in the ICU with major infections. I mean, you got to be really stupid to do that.
Yeah, but it's rampant, right, Sean? I mean, Groupon, that's a great thing to talk about. I mean, so is that something that's appropriate for plastic surgery? Because that's basically a group buy for a good price.
I think it's making what we do into a commodity, and I think we've all been trained, and our ethics are to not do that, or to take good care of patients, provide safe treatment and excellent outcomes. And I think as a surgeon, I don't want other people doing what I do. No one here does. I want to do my breast augments, I want to do my liposuction, I want to do all the injections. But I think the fact of the matter is that there are other medical professionals out there, doctors, PAs, or nurses, and I think we need to maintain our good practices. And I think we need to provide good care for patients, and I think just going forward, we need to maintain ownership of our treatments.
I would totally agree with you on that. Go back to the other topic for a second. I really think the issue is that the patients are waylaid into believing that they're getting something that we can't get. This is legal in Brazil, it's not legal here, but it's okay there, so we snuck it in, we're going to give it to you.
Right.
So I think they're thinking it's something advanced or something that we can't get here, and they're getting something different or better. And there's a reason for the FDA. The FDA does a damn good job of making sure that crap doesn't get into our U.S. patients.
Correct, I agree.
So when things are FDA approved, I'm all for it. And when they're not FDA approved, big thumbs down for me.
But the other thing that's changed in the past 25 years is 25 years ago, it was really hard to market something. Now it's really a lot easier. Do you think that just the digital age of Snapchat, social media, internet, has that changed the way this goes down?
Absolutely. I was never trained how to utilize social media in order to educate patients or take care of patients, but that's what we have to do now. And I think that nurses or other doctors that actually have a strong social media presence have a leg up on us, and I think that we just need to stay ahead of the game, stay ahead of the curve.
Yeah, I would agree. I mean, some people build whole practices on just their internet savvy.
Right.
Good for them.
Right.
Good for them. I don't have time for that, but good for them.
Right.
If it sounds too good to be true, is it?
Yeah, absolutely.
There you have it. More info on theplasticsurgerychannel.com.